Your doctor tells you your blood work is fine, and in many cases, they're telling you the truth based on the tests that were actually ordered. But here's the uncomfortable reality that very few people sitting in that waiting room ever hear. Normal does not always mean optimal, and standard blood panels often miss the early warning signs of the most devastating health conditions affecting adults over 60. Every year, millions of older adults walk out of clinics reassured, while silent processes are already underway inside their bodies, processes that, if caught early, could be slowed, reversed, or even prevented entirely. The gap isn't always your doctor's fault. Modern medicine is incredibly efficient, but it is also time-limited. Most physicians follow standardized panels designed to catch advanced disease, not early dysfunction. And that distinction matters more than you think, because by the time many conditions show up clearly on standard labs, they've already been developing quietly for years. Let me give you a perspective that should stop you in your tracks. Prediabetes alone affects tens of millions of adults. Most have no symptoms, many have normal fasting glucose, and yet, damage to blood vessels, nerves, and brain tissue may already be in progress. Cognitive decline? It often begins 10 to 20 years before symptoms become noticeable. Heart disease? The inflammatory processes behind it can smolder silently for decades. So today, you're not just learning about blood tests. You're learning how to see what most people miss. You're learning how to catch problems early, when they are still manageable. And most importantly, you're learning how to advocate for your own health in a system that doesn't always have time to explain everything. I'm Dr. Sarah Mitchell, and this channel exists for one reason: to give adults over 60 clear, evidence-based health information that empowers you to take control of your future. If you're new here, make sure you stay connected, because what you learn here could genuinely change the trajectory of your health. Now let's get into the 5 blood tests that could reveal more about your future than your current normal results ever will. The first test is hemoglobin A1C. Most people are familiar with fasting blood glucose. You go in early, you haven't eaten, and they measure your blood sugar at that exact moment. If it falls within a certain range, you're told everything looks fine. But here's the problem. Blood sugar is highly dynamic. It rises after meals. It falls between them. It fluctuates based on stress, sleep, medications, and activity levels. So a single reading is just that, a snapshot. It tells you what happened at one moment in time. A1C is different. It measures how much glucose has attached to your red blood cells over approximately the past 3 months. In other words, it shows the pattern, not the moment. And that distinction changes everything. Because many people with normal fasting glucose still have elevated A1C levels, meaning their blood sugar is consistently running higher than it should throughout the day. Now let's talk about why that matters. Even mildly elevated blood sugar, levels not high enough to be called diabetes, can begin damaging your body. It affects the small blood vessels in your eyes, increasing the risk of vision problems. It stresses your kidneys, often years before any symptoms appear. It stiffens arteries, contributing to cardiovascular disease. And perhaps most concerning of all, it affects your brain. Emerging research shows that elevated blood sugar is associated with faster cognitive decline, even in individuals who are not diabetic. This is why some researchers now refer to Alzheimer's disease as type 3 diabetes. So what numbers should you be looking for? An A1C below 5.7% is considered normal. Between 5.7% and 6.4% is classified as prediabetes. And 6.5% or higher indicates diabetes. But here's the key point. Prediabetes is not harmless. It is an early warning sign. It is your body telling you that something is already going wrong and giving you time to correct it. Because at this stage, lifestyle changes can have a powerful impact. Improving diet, increasing physical activity, managing sleep, and reducing stress can significantly lower A1C levels. But only if you know where you stand. The second test is 25-hydroxy vitamin D. Most people think of vitamin D as something related to bones. And while it does play a crucial role in calcium absorption and bone health, that's only part of the story. Vitamin D functions more like a hormone than a traditional vitamin. It influences immune function, inflammation, muscle strength, and even brain health. And deficiency is far more common than most people realize, especially in older adults. As you age, your skin becomes less efficient at producing vitamin D from sunlight. You may spend less time outdoors, and your body may not absorb or utilize it as effectively as it once did. The result is a widespread, often unnoticed deficiency. Now here's where things get important. Low vitamin D levels have been associated with increased risk of falls due to reduced muscle strength, higher rates of fractures, weakened immune response, increased inflammation, greater risk of cardiovascular disease, and a higher likelihood of cognitive decline. Yet many people are told their levels are normal when they are barely above the minimum threshold. Most labs consider levels above 20 nanograms per milliliter to be acceptable. But many experts suggest that optimal levels for older adults fall between 40 and 60 nanograms per milliliter. That's a significant difference, and it's one that can impact how you feel every single day. Fatigue, joint pain, low mood, and muscle weakness are often dismissed as normal aging, but in many cases, they are symptoms of something correctable. The third test is high-sensitivity C-reactive protein, or hsCRP. If there is one underlying factor connecting heart disease, Alzheimer's, diabetes, and even certain cancers, it is chronic inflammation. Not the kind of inflammation you see when you cut your finger, but low-grade, persistent inflammation inside your body. It doesn't cause immediate symptoms. You don't feel it happening. But over time, it damages blood vessels, disrupts normal cellular function, and accelerates aging at the biological level. hsCRP is one of the most sensitive markers we have for detecting this hidden inflammation. And its predictive power is remarkable. In some studies, hsCRP has been shown to be a stronger predictor of heart attacks than cholesterol levels. Think about that. For years, cholesterol has been the primary focus of cardiovascular risk assessment. And yet inflammation may be an even more critical factor. So what should your number be? Below 1.0 milligrams per liter is considered low risk. Between 1.0 and 3.0 is moderate risk. Above 3.0 indicates high risk and warrants further evaluation. But here's what makes this test so valuable. Inflammation is modifiable. It can be reduced through diet, exercise, weight management, stress reduction, and proper sleep. But again, you have to know it's there first. The fourth test is thyroid-stimulating hormone, or TSH. Your thyroid is a small gland, but its impact on your body is enormous. It regulates metabolism, energy production, temperature, heart rate, and even mood. When it slows down, everything slows down. And here's the problem. The symptoms of an underactive thyroid, fatigue, weight gain, depression, brain fog, constipation, are almost identical to what many people assume is just aging, so they ignore them. Or worse, they're told nothing is wrong. Now let's talk about ranges. Most labs consider TSH levels up to 4.5 as normal, but many experts believe that optimal levels are closer to 0.4 to 2.5. That means someone with a TSH of 3.8 might be told they are perfectly fine, while still experiencing significant symptoms. This is where context matters. This is where how you feel matters. Because numbers alone don't tell the whole story. The fifth and perhaps most overlooked test is homocysteine. This is an amino acid in your blood that, when elevated, becomes toxic to blood vessels and brain cells. High homocysteine levels are associated with increased risk of stroke, greater likelihood of heart disease, and significantly higher risk of cognitive decline and Alzheimer's disease. And here's the critical part. It is highly modifiable. Elevated homocysteine is often the result of deficiencies in specific B vitamins, particularly B6, B12, and folate. Correct those deficiencies, and you can often bring levels down. So what is the target? Below 10 micromoles per liter is ideal. Between 10 and 15 is moderately elevated. Above 15 is high and should be addressed promptly. What makes this test so powerful is not just what it reveals, but what you can do about it. Because unlike many risk factors, this is one you can actively improve in a relatively short period of time. Now let's step back and look at the bigger picture. These 5 tests, A1C, vitamin D, hsCRP, TSH, and homocysteine, offer something that standard panels often don't: early insight. They help you see what's developing beneath the surface. They give you time. Time to adjust your habits. Time to work with your doctor. Time to prevent rather than react. Because once a major event happens, a heart attack, a stroke, a diagnosis of dementia, the conversation changes. It becomes about management, not prevention. But before that moment, you have influence. You have options. And that's what this is really about. Not fear, not panic, but awareness. Because the truth is, your body is constantly sending signals. Subtle changes, small shifts, early warnings. These tests are simply tools to help you read those signals more clearly. So here's what I want you to do next. Before your next appointment, write these 5 tests down. Hemoglobin A1C, 25-hydroxy vitamin D, high sensitivity CRP, TSH, homocysteine. Bring that list with you. Ask for them directly. Have a conversation, not just about what is normal, but about what is optimal for you. And remember this, you are not being difficult. You are not overreacting. You are being proactive, because no one will ever care about your long-term health as much as you do. And the more informed you are, the better decisions you can make. Your future health is not determined in a single moment. It is shaped over time by the information you have, the actions you take, and the choices you make every day. So take this seriously. Take action. And most importantly, stay engaged in your own care. Because the difference between aging passively and aging powerfully often comes down to one thing: knowing what to look for and doing something about it.